Good morning, everyone. My name is Dr. Andrew. Today, we are going to talk about the brachial plexus, its root, trunks, division, and cause, and what is the injury that could be happen to brachial plexus. I hope you enjoy.
What is the brachial plexus? Brachial plexus, it is the nerve that supplying the upper limb that is originate from the anterior rami of spinal cord. It is divided into roots, trunk, divisions, cores, and terminal branches. Roots start from C5, C6, C7, C8, T1. C5 and C6 unite together to form the upper trunk. C7 will form alone middle trunk, while C8 and T1 will form the lower trunk. Okay, the upper trunk will divide into anterior division and posterior division. And the middle trunk will divide into posterior division and the anterior division. And lower trunk will divide into anterior division and posterior division. So the three posterior division of the upper and the middle and the lower trunk will unite to form the posterior cord. Posterior cord. Posterior cord will divide into 5 main branches, which by mnemonic called ulnar, upper subscapular nerve, lower subscapular nerve, nerve to latissimus dorsi, axillary nerve, and radial nerve. Okay, this is the posterior cord, which originates from the union of the posterior division of both upper and middle and lower trunk. While we talked about posterior divisions, and let's talk about the anterior division. The anterior division of the upper trunk will unite with the anterior division of the middle trunk to form lateral cord. And the anterior division of the lower trunk will form the medial cord. Okay, then the anterior division of the upper trunk and middle trunk will unite together to form the lateral cord. The lateral cord will give a lot of branches. First, musculocutaneous, which is the nerve of brachialis, which is the main, and biceps, which controls flexion. And will give also lateral pectoral nerve, which supplies pectoralis major, and will give also lateral root of medial nerve. While the lower trunk, which will give the medial cord, will give also multiple branches. One of these branches, it is the ulnar nerve. Ulnar nerve shares inflection of the full arm and supply all muscles of the hand. Flexion of the wrist, sorry. And supply all muscles of the hand except some muscles that is supplied by median nerve. So the medial cord will give also medial root of medial nerve. The medial root of medial nerve and lateral root of medial nerve will form the median nerve itself. Okay, let's recap it again. There is root C5, C6, C7, C8, T1. Trunks C5 and C6 will form the upper trunk, C7 will form the middle trunk, C8, T1 will form the lower trunk. The three posterior division, there will be divisions, anterior and posterior to all of them. The anterior division of the middle trunk will unite with the anterior division of the upper trunk to form the lateral cord, and the anterior division of the lower trunk will form alone the medial cord. Lateral cord will form lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve, while the medial cord will form medial root of median nerve, which will unite with the lateral root of median nerve to form median nerve, and ulnar nerve, and medial pectoral nerve. So when there is affection of C8 and T1, or affection of the lower trunk, there will be affection of the ulnar nerve and some affection of the median nerve. And when affection of the upper trunk, C5, C6, there will be affection of the musculocutaneous nerve and flexion will be deformed. When there is affection of C5 and C6, there will be a deformity called Erb's palsy, which we will talk about. And when there is affection of C8 and T1, there is a lesion called Klumpke. We will also talk about later. Okay. There is a root, trunk, division, cord, and terminal branches. Okay. There is something that we forgot to mention before, that the roots arise from it multiple branches, like dorsal scapular nerve originate from C5, and long thoracic nerve originate from C5, 6, 7, 8, and T1. Originate from all the roots of the brachial plexus. It is the long thoracic nerve. Okay, when there is any injury of this nerve, can cause winging of a scapula. The scapula become like a wing of a bird. Okay. C5 and C6 unite together to form the upper trunk, and C7 will form along the middle trunk, and C8 and T1 will form the lower trunk. Okay, each of which divide into anterior division and posterior division, anterior division and posterior division, anterior division and posterior division. All posterior divisions are unite to form the posterior cord, and posterior cord will divide into 5 main branch, which called a pathognomonic called ulnar, while the upper trunk anterior division will unite with the middle trunk anterior division to form the lateral cord, which give muscocutaneous and lateral root of medial nerve and lateral pectoral nerve. The lateral root of medial nerve unite with medial root of medial nerve to form the medial nerve itself. The medial root of medial nerve comes from the lower trunk, which gives the medial cord. Medial cord, it is an extension of the anterior division of the lower trunk. And we will see this picture again. This is the brachial plexus, which supply the upper limb. It is passed, the roots pass between scalenus anterior and medius, and the division, it is behind the middle third of the clavicle. Okay. Okay, it is between the scalenus anterior and medius, and the base and the trunk at the base of the posterior triangle of the neck. The division behind the middle third of the clavicle, and the cord in the second, related to the second part of axillary artery. Okay, what will happen if there is affection of the brachial plexus? When there is affection of the brachial plexus, we got a lot of lesions. The most common lesion that we will got, it is Erb's paralysis or Erb's palsy and Klumpke paralysis. Erb's palsy or paralysis comes from affection of the upper trunk, and Klumpke paralysis from affection of the lower trunk. Okay, Erb's paralysis occurs due to affection of the upper trunk. Let's remember the upper trunk, it is mainly from C5, C6, and will divide into division, anterior division and posterior division. Posterior division will unite with the other posterior divisions, and the anterior division will form the lateral cord. Lateral cord will form musculocutaneous and lateral pectoral nerve and lateral root of median. Okay. There is paralysis of abductors. Why there is paralysis of the abductors? Because there is affection of supraspinatus and the deltoid. Let's remember, deltoid is supplied by axillary nerve, which is one of the posterior cord, which shares the upper trunk shares in the posterior cord itself. Okay, so axillary nerve will be affected, so the deltoid will be affected, and supraspinatus, it is can cause abduction from 0 to 15, and the deltoid can cause abduction from 15 to 90. If there is failure in those muscles or nerve supply of those muscles, there will be adduction So the deformity will be adduction. Okay. Due to affection of supraspinatus and the deltoid. Supraspinatus, it is supplied by suprascapular nerve, which is supplied by the supraspinatus, which comes from the upper trunk also. So if there is affection of supraspinatus and axillary nerves, there is adduction due to failure of abduction. Okay. Number 2, there is paralysis of external rotators. Why? Because the muscles that cause internal rotation are paralyzed. Why? Infraspinatus and teres minor. Infraspinatus is supplied by suprascapular nerve, and teres minor by axillary nerve also. So there will be external rotation due to failure of internal rotation. Number 3, there is paralysis of the forearm flexors and supinators. Why? Because forearm flexors and supination due to affection of musculocutaneous nerve. Musculocutaneous nerve supply brachialis and biceps. Brachialis, it is the main flexors of the forearm. So if there is affection of musculocutaneous nerve which comes from the lateral cord of the upper trunk, it will cause paralysis of flexion, so the forearm will be extended and pronated due to affection of median nerve and musculocutaneous nerve, which can cause supination and flexion. And finally, there is paralysis of extensor carpi and radialis. Why there is paralysis of extensor carpi radialis? Because the radial nerve, which comes from posterior cord, which come from the union of 3 trunks, it is affected. So the radial nerve will be paralyzed, so there will be extension. Okay, there will be extension of the there will be affection of extensor carpi radialis, so it will cause wrist flexion. So as we see this lesion, there is the forearm and the arm are extended, adducted, and internally rotated, and the wrist is flexed. Okay, it is called waiter tip deformity or Paul's tip deformity. So when there is affection of the upper trunk, there will be this lesion. As we mentioned before, that the forearm is extended. Why there is extension? Due to failure of flexion, due to affection of musculocutaneous nerve, which comes from the lateral cord. Why there is wrist flexion? Due to affection of extensor carpi radialis, which is supplied by radial nerve, which comes from the posterior cord. There is internal rotation due to affection of external rotator like infraspinatus and teres minor. There is adduction, arm adduction, due to affection of the abduction, supraspinatus and the deltoid, which supplied from the posterior cord. And lastly, there is sensory affection, loss of sensation of the radial side of the arm, as the radial side comes from the radial nerve and median nerve, mainly the lateral root of median nerve. So there will be affection of the radial side of the arm and forearm. Okay, let's talk about Klumpke. Klumpke occurs when there is injury of the lower trunk, which is C8T1. Okay, there will be a motor affection, which called claw hand deformity. Claw hand. This is claw hand. Okay. Okay, there is paralysis of all intrinsic muscles of the hand. Why? Due to affection of the ulnar nerve, which is main nerve supply of the all muscles of the hand. Okay, and there will be wasting due to the main nerve that supplying it is paralyzed, which the ulnar nerve comes from the medial cord. Medial cord comes from the anterior division of the lower trunk. There is paralysis of the wrist, fingers, flexors. There will be weak wrist and finger flexion. Why? Due to affection of flexor carpi ulnaris and flexor digitorum superficialis profundus. That the ulnar nerve share the nerve supply with it. So if the ulnar nerve is affected, there will be affection of the movement of the flexion. There will be hyperextension of metacarpopharyngeal joint and deflection of proximal interpharyngeal joint. Those movement will be unopposed action. One from unopposed action, hyperextension of metacarpopharyngeal joint due to unopposed action of extensor digitorum, and flexion of proximal interpharyngeal joint due to unopposed action of flexor digitorum superficialis. There will be sensory affection due to loss of sensation over the ulnar border of the forearm and the hand. Okay, this is the claw hand deformity, and this is the ellipse palsy. And at this time we end our lecture. I hope that you enjoy and you got the brachial plexus. Don't forget to like the video and subscribe the channel. Thanks for watching.